Hello, everyone, and welcome to another webinar in our Health Reform Beyond the Basics series. Thank you so much for taking the time to join us today. Most of you have been a part of our Beyond the Basics series for a while, but for those of you who are new, I am Hallie Cloud, and this is the project of the Center on Budget and Policy Priorities. It's designed to provide training and resources that help explain health coverage options available through the marketplace and Medicaid. It is aimed at healthcare assisters, state and local officials, advocates, and others who help people get and keep their health coverage. We are a policy nonprofit in DC, and as a reminder, this series is intended for those working on the implementation of health reform and is not intended for press purposes. Today's webinar will detail how assisters can help people prevent and resolve data matching issues that arise when the marketplace determines that information people provide as to their income or citizenship or immigration status doesn't match information available to the marketplace. So with that, I'm going to introduce our presenters today. We have Shelby Gonzalez, who's a senior policy analyst here at the center, and Tara Straw, who is also a senior policy analyst at the center. And with that, I'm going to turn it over to Shelby. Take it away.
Thanks, Hallie. And good afternoon, everyone. Thanks for joining our webinar today about data matching issues. Our goals today are to talk about how to prevent data matching issues as well as how to resolve them when they do occur. So first, we're going to get started by talking a little bit about the federal hub and how different eligibility factors are verified when somebody is going through the marketplace application. And I should take one moment to just say that a lot of what we're talking about today is really outlining the process that's very specifically used in the federally facilitated marketplace, so in healthcare.gov. But not necessarily, some of this is still going to happen, or it's going to be very, very similar in state-based marketplaces, but there might be different process steps, so in some places we're going to talk about notices people receive and how it looks on the screen. Obviously, those are things that are going to be very unique in every different state-based marketplace. But nonetheless, no matter which marketplace consumers are going to interact with, there's going to be a lot of electronic data matching that occurs. So consumers that go through the application provide certain information. They're making attestations. They're at the end of the application, and sometimes at the beginning, depending on how the application is worded. The person knows that they must provide. They're told over and over again, you must provide truthful and accurate information about your circumstances. You as assisters should always, reinforce that, and people do. People, provide truthful and accurate information about their circumstances in the applications. Some of the factors are going to be checked. Some of the factors that are very important towards making eligibility determination are going to be checked electronically as kind of the first line of defense, right? That electronically by checking information that's held in different data sources, including things like the Social Security Administration that will help to substantiate claims that somebody says that they're a citizen, or to verify the Social Security numbers that are provided. The IRS will verify things like income and the Medicaid, it's different Medicaid agencies provide information about people who have, that are enrolled in Medicaid. All of these kinds of factors are kind of consistently being checked behind the scenes. In some cases, states that have their own marketplaces even bring in additional factors, which is, oftentimes this is very, very helpful to consumers because it means that they don't have to provide documents that prove their circumstances, for each of these eligibility factors. So oftentimes this helps save people time, and it helps prevent them from having to take many extra steps and to look for documents that they might not be easily accessible to them. Other factors, eligibility factors in the application process are just accepted with the attestation, and that could include things like state residency, for example. So certain factors must be verified must be verified in one way or the other, and the first line of defense is to try and do that electronically to minimize the additional burden, but there is also a pathway for people who can't go through the electronic process to verify their circumstances if that doesn't happen. So, for a variety of reasons, some of these electronic data matches may not work for different people. For example, if a consumer didn't file their recent file taxes in the recent years, or perhaps maybe their situation has changed significantly from one year to the next year, those might be reasons why a data, that the verification sources, the electronic data verification sources, would not be able to substantiate the information that is provided by the consumer in the application. Another example is, for citizens that, that weren't born in the US, but maybe they naturalized, they went through the process to become a naturalized US citizen. For a lot of those folks, the SSA, which is Social Security Administration, would not know that that person's a citizen and would not be able to substantiate that kind of claim. So it's super important to remember that, one, there's a great effort that's always done to verify things electronically when possible. And sometimes people's circumstances can't be verified electronically, and that does not mean that they did not tell you the truth. It does not mean that that they're not eligible. It just means that for a variety of reasons, their information is not compatible with the data, which is limited in some ways, right? Because all these other data sources, while they have great, good information, there's a variety of reasons why it's not going to always be set up in a way that can or captured in a way that can, these systems aren't set up for the purpose of, determining eligibility for benefit programs. These systems are set up for different purposes, so it's not going to always be perfect. But nonetheless, it's great when it works. So, when there is a data matching issue, the eligibility determination notice will say that more information is needed to verify the eligibility factor, and it will also list the different kind of documents that can be provided to verify that eligibility factor. And most consumers can enroll in a plan and can even receive their subsidies during what we call an inconsistency period. And that period could either be 90 or 95 days long, depending on whether or not it's a citizenship or immigration status issue that they're trying to address, or whether it's another eligibility factor. So, just to give you a sense, and this really does this is going to be a description of what happens on healthcare.gov. So when you're helping somebody through the application and they have a data matching issue, they will get they will be notified on screen before you click on the PDF that gives them their eligibility notice. They will already be told that their eligibility is temporary, and they'll tell them how long, like by what date somebody would have to provide more documents to confirm that they're eligible. Then when you click on that PDF and you get the eligibility determination notice, there'll be a little bit more information about the kind of data matching issue that is a problem, and will also provide information to the consumer about what documents they could provide to resolve the issue. So anytime there are going to be a number of notices that consumers get when they have a data matching issue. They'll get warning notices at different, timetables, so they'll be getting things in the mail. They'll also get emails and text alerts. They're going to get the 15-day warning call. This was true last year. We hope this is true this year, but we have not confirmed that that is still a practice that will be taking place this year. But certainly in past years, this is something that was happening. Then there's also other kinds of notices. So in certain cases, individuals will send in some type of document that is seeking to resolve the data matching issue. But if it's not going to be sufficient, from the standpoint of the marketplace to resolve the matter, they should get was referred to as an insufficient document notice, and that notice should give some additional instruction to the consumer about what would be needed, and what could could be used potentially to resolve the data matching issue. If the DMI is not resolved, what happens? The consumer will get what we refer to as an expiration notice, and that basically means that they have failed to provide proof of the eligibility factor, and there'll be one of, depending on whether it's a citizenship or immigration, in the case of a citizenship or immigration DMI, the consumer would be told that their coverage is going to end. And then there's also, of course, notices that are provided to consumers that have successfully resolved their DMIs as well. So I'm going to talk a little bit about verification of citizenship and immigration status, and then later you're going to hear from Tara, who's going to talk about other eligibility factors. So healthcare.gov uses social security numbers for a variety of reasons in the application process. And one of those reasons is that the applicant who attests to being a citizen, that the SSN, the Social Security number, will be checked against records that the Social Security Administration holds. And if citizenship can't be verified by SSA, the applicants are asked if they are naturalized or derived citizens. Naturalized meaning that they've gone through a process to become a citizen that, we oftentimes, that is referred to as a naturalized process, so they weren't born in the US. Or, derived citizens are folks that they derive their citizenship through their parents, but they weren't born here. Those who answer yes to the questions are asked to provide document numbers from their naturalization certificate or certificate of citizenship. And if these numbers are provided, the marketplace will then try to electronically verify citizenship through records that the Department of Homeland Security holds. And we refer to that to this database that the Department of Homeland Security holds as the SAVE system. What's important to note about this is that the vast majority of US citizen children are going to be able to successfully be verified if they provide their Social Security number in the application. A lot of adults as well will be able to be successfully verified, if they provide the Social Security number and the correct information. But of course, not everybody will, right? And there's a variety of reasons that this could happen. Part of it is sometimes we've heard people just make the wrong attestation. They see, are you a US citizen? And, that's not always the clearest question. They might think of themselves as citizens, but the reality is maybe they are lawful permanent residents, or they're somewhere in the process of becoming a citizen, or that kind of thing. So it is not unheard of. I've actually heard of people answering the other question by accident and saying that they're, qualified. They meet the immigration requirement, and then it turns out they really are citizens. So sometimes people just make mistakes in the application. So that's one thing that you would always want to go back and check, especially if you're working with somebody and it's just, you're not able to successfully resolve a data matching issue. One thing that you might want to think about is whether or not the right attestation was made. Some people don't provide their Social Security number or other document numbers. You know how I mentioned that for folks that were either naturalized or derived citizens and they're asked to provide these other numbers, a lot of those folks don't have those numbers easily accessible to them for a variety of reasons. They instead use their passport when asked to provide proof of their citizenship, and they, who knows where these other documents that contain those numbers, are. sometimes, there's a variety of factors that are used to do these kind of data matches, right? Name, date of birth, social security number, those are all sent over, and that's how the electronic data matching works. And when there's a no match, sometimes it might be because there was a typo, a significant enough typo that there isn't enough forgiveness built into the data matching. Sometimes people use like a nickname or something instead of like the name that's on their record. So that's something that you want to ask people, right? When you're talking to them and helping them, it's like, what is the name? Like when we're filling out the application, we want to make sure that we are providing the name that is officially used in your records, like when you were issued a social security card. And in fact, the application will give consumers an opportunity that, if maybe their name is Joseph, but, they go by Joey, and in the application they said Joey, there's another place in the application where they'll say, hey, is there another name that you use, and then they can use that other name when they're doing this data matching. Sometimes people have changed their names. They might have gotten married. The Social Security Administration, which again is the holder of a lot of this data, and that helps people to have to avoid any kind of data matching issue for citizenship, because they verify so many people's citizenship this way. It doesn't, consumers don't, when they get married, they don't immediately go running to the Social Security Administration to change their name. So a lot of people, they just don't have up-to-date information like that, and that can cause the problem. Data matching limitations. So there are certain folks, that were born outside of the U.S. where the Social Security Administration just can't verify their citizenship for a variety of reasons. And then other consumers may not have those numbers, as I mentioned beforehand. So when this happens, consumers, when there's a data matching issue related to citizenship, consumers have to provide some documentation that proves that they're U.S. citizenship. And it's tricky because, all the documents that we have listed on this page, they're sufficient to go ahead and prove citizenship without any additional documents. So a U.S. passport or certificate of citizenship or, certificate of naturalization are all examples, and others here listed, of documents that hold on their own, and this is sufficient. But for many people, they don't have those documents. And in that case, they have to provide two documents. We have a listing here, and if you look on the left-hand side, we have a list of documents that really are about providing proof of citizenship. And on the right, we have a list of documents that are really about providing proof of identity. And you got to marry those two. You got to prove both citizenship and identity to be able to accomplish the task of proving your citizenship. So if you have one of these documents that are on this slide, enough. You've done both proving your identity and your citizenship. You'll notice that most of these have pictures on them, and that's part of the trick here. And then here, you would have to do one from the left-hand side and one from the right-hand side. So for immigrants that are attesting to having an eligible immigration status, this is how it's done on the application. It's going to ask, in this case, that if Jane is a U.S. citizen, she says no, then it's going to ask her to check if she has an eligible immigration status, and then it's going the marketplace application will ask her to select from a very long list of potential documents that a consumer might have, and they also have an option to put other documents if the document that they have that proves their immigration status is not listed. That's another option. So the consumer picks one of these documents that's relevant to them and provides different numbers depending on what document they've selected. And then the marketplace uses the information provided here in the application for this consumer, and then it sends that information over to the Department of Homeland Security SAVE system, and they will attempt to verify immigration status that way. In some cases, they might even have to go a second time to, they might not be able to verify it right then and there, when you're doing the application, but the healthcare.gov will give it another shot afterwards. They're going to do a second try even after you've hit submit to the application. So there's a variety of reasons why data matching may not be successful for people who have an eligible immigration status for the marketplace. Oftentimes people fail to provide the document numbers, or they provide the wrong numbers. And that's not that uncommon because it's pretty complicated. It's not super intuitive. When you look at some of these documents, and we have a whole, I don't want to get ahead of myself, but we do have a resource that details a lot of these documents and what kind of numbers and which ones you want to look for. But it's not necessarily something, especially consumers that are doing this on their own, is not like in, big bright letters it says on the document, this is the number you put into healthcare.gov that's going to make the right, eligibility verification happen, right? That it's not that clear. So it can be complicated. And again, we have a resource that can help you as, folks that are helping people enroll, look for the right numbers. Again, similar to what we saw for citizens, right? There might be typos, there might be name changes, maybe somebody used a nickname, all sorts of things like that can happen. And then simply the database, the saved database is just simply not able to instantly verify everyone's, immigration status. There are some complications. There are certain groups of folks that they will never be able to verify like this in real time. Others, it might just be a matter of timing, right? Maybe you're working with somebody who just arrived here, they just got their status, or might be a delay in terms of, say, being able to have the data that's needed. There's a variety of reasons why this could happen. So if citizenship or immigration status, DMI is not resolved, well, first of all, if there is a DMI that occurs for a consumer, the applicant is able to, it's given 95 days to provide documents that resolve the matter. And if they don't provide that information, and that information is not processed by the marketplace during that 95-day window, their coverage is going to be terminated. And I want to emphasize that a little bit more, that it's not just that you can wait until the 94th day and then you send in the documents and you should be all good, right? That's not what we're talking about here. Because this 95-day window also includes the time that the marketplace needs to be able to process the documents. So you want to keep that in mind. And if you're getting close to that 95-day where they're about ready to have a DMI that's going to expire, you can pick up the phone. Now, I can't promise this is going to work 100% of the time, but it can't hurt you. Pick up the phone and call the marketplace and let them know, hey, we just uploaded the document, a passport for Miss Gonzalez, and she's, it's on its way. We know that their data matching window is going to close very soon, so we want to know if you can give us a few more days. And we are told that in some cases that is granted. Now, if this is the third time that you're calling, or even second time, maybe it won't be, but it's worth the effort to try. If this is something that you're nearing the end of that 95-day window, okay? And it's worth it because bad things happen, right? Like people's coverage might be, there might be a gap in coverage that could be otherwise avoided by doing this, taking that kind of step. So if the consumer submits documents after coverage has been terminated, or, you submitted them and then the marketplace resolves it after coverage has been terminated, which is probably what happens often, right? The consumer is eligible for a special enrollment period to re-enroll in coverage. And that SEP, that special enrollment period, will begin the day their DMI is resolved. And they'll have 60 days from that day to enroll in coverage. And they can choose to have coverage begin both retroactively to the date of termination, Of course, they would have to pay any kind of premiums, that would have occurred during that retroactive period. They can also choose to have coverage begin prospectively after the plan is selected. So I'm not going to read this to you. I'm sure you guys are very happy about that. But so for different kind of, what we've listed here, it's kind of just, it's a resource, is different kind of document types, and then what numbers healthcare.gov is going to request that you get from those different document types. And like I mentioned, and there's a long list of this, right? We also have a reference guide that gives you some pictures and examples of different kinds of documents. But here in these pictures, you'll see lots of different kinds of iterations of a card that would be given to, or that a lawful permanent resident would have. Oftentimes we refer to lawful permanent residents as green card holders. These are different examples of what they might have. And you can see that they're not always green, even though we call them green card holders. And you can also see that the numbers are found in different places depending on what iteration of a card you have. So there is a reference guide that helps walk through what we're talking about. Like look, in the middle of the slide here, where the one number, has, starts with the where we circled this number that is in a sea of numbers seemingly, right? Like how would you just know intuitively that that's the number we're looking for, right? So it can be complicated. So I do recommend to have a copy of the reference guide, like on your desktop, so that it's easy to access, especially if you don't work with a lot of immigrants, because when you work with a lot of immigrants, maybe you've got this down and you've memorized it. But if you only work with some, then it's always helpful to look at the resource. So I'm gonna walk through a quick example of a family that is going through, we're gonna say, healthcare.gov. So we have Roberto and Monica, and they're married. They have two children, Miguel and Elena. And Monica was born in Germany, and she's a derived citizen. That means, in this case, we're gonna say that her parents were US citizens. She was born in Germany, and when she was born there, she was able to get her derived citizenship. Roberto is a lawful permanent resident. He's been a lawful permanent resident for 7 years. And Miguel and Elena, the children, are both US born citizens. So all family members provide their social security numbers on the application, and Monica, Miguel, and Elena attest to being US citizens, because they are. And Monica, because remember how I mentioned that oftentimes people who are either naturalized or derived citizens are asked that extra question. Well, in Monica's case, she got asked the question. So she said yes. And Monica does not have the certificate of citizenship, so she skips that question. And that's something that people can do. They can skip the question, and you will likely work with a lot of people who don't have that, or they don't have it with them when they come to an appointment to sign up for healthcare, because they did not know that was going to be something that they would need, right? And Roberto, he's the lawful permanent resident. He attests to having an eligible immigration status, and he provides his A number, but not his card number. In his case, he's going to be asked for both those numbers, and we're just going to say that he just provides the A number. So let's look at what happens to their data matching results. So Monica, was not successfully matched by the Social Security Administration through the electronic data matching, nor was she successfully matched through the SAVE system, because she didn't provide the number that would be needed, right, to be able to make that data matching happen. Roberto, he's not going to, his status, his immigration status, is not going to be tested through SSA, because he is not a citizen. And then he did not get a successful match, we'll say, for whatever reason. Maybe it's because he didn't provide the card number. He only put the A number in. Sometimes it'll work to just provide the A number, but in his case, we're going to say it didn't. And then Miguel and Elena, important to know, oftentimes we have a little bit more success with SSA data matching, not always. It's pretty big. It's a pretty sizable percentage of children. There's a match. all good with the kids, and they don't have a data matching issue. So Monica and Roberto are instructed to provide documents to prove their status within 95 days. And all family members are approved to buy marketplace plan and are awarded advanced premium tax credits. So in the notice, Monica and Roberto are both asked to provide documents to prove their status, right? And they are provided some information about what that means and what kind of documents would accomplish that. They're also given, they're told that it's 95 days. They're told that it's a temporary eligibility determination, because there's a data matching issue. So Monica and Roberto get warning notices and emails explaining that their coverage will end if sufficient documents are not provided. And what we'll say is that Monica submits her consular report of birth abroad. But remember how I said beforehand that for citizens, unless you have like one of those documents like a US passport, you're going to have to provide two pieces of documentation. One that proves your citizenship and the other that proves your identity. So Monica only provides the one that proves her citizenship. Roberto sent in his foreign passport, which in some cases may be used to prove lawful permanent residence, but we're going to say that in his case, it's not going to be sufficient. And, and I use this example because consumers get a very long list of documents and it can be confusing to them, and not every one of them is applicable to their circumstance. So in Roberto's case, sending in the foreign passport, not going to be enough. If he were somebody who had had a specific kind of stamp in his passport, that's what is used to prove their immigration status, then it would be enough, but that's not his case, okay? So what happens next? Roberto sends in a copy of his, Monica gets we'll go into each one individually. So Roberto sends in a copy of his green card, and Monica does not have a document. Remember how we said there's the two? She doesn't have a document that proves her identity. So she's in trouble, right? She needs to get a document to prove her identity. In her case, the window runs out. The 95-day window runs out, and she gets an expiration notice explaining that her coverage is going to end because she did not provide sufficient documentation to prove her citizenship. Roberto, who sent in a copy of his green card, he's fine. He's not going to get the expiration notice. He's going to continue to be able to enroll in coverage. Okay, so Monica, let's see if she can regain her coverage, right? We said earlier that if and when a consumer does satisfy this requirement, even if it's past the 95-day window for resolving the DMI, it can still happen, right? So what in Monica's case, we'll say that she was able to get, she went to the DMV, she got the documentation she needed, and she, though she lost coverage, she was able to get a picture ID. She uploads a copy to the marketplace. The marketplace then processes that information, and will say that Monica's DMI is resolved, and she's able to then select another plan, and then she has this option of using this SEP to enroll in coverage either retroactively or moving forward. I'm going to turn it over to Tara because I think I went a little long.
Thanks, Shelby. We're going to talk a little bit about household income verification. So on the application, as you know, applicants are asked to provide information on the source and the amount of income for everyone in the household. And there are a lot of prompts within the application to help you get there. And then those attestations of your income are matched with data in the federal data hub. So what are the possible outcomes of that? Well, in general, there is a threshold to trigger a data matching issue, DMI. And that is if the attestation is different by more than 25% of the income in the data hub and at least a difference of $6,000. So basically, if you break that down and do the math, it's the greater of 25% or $6,000. That's the kind of difference that will trigger a DMI. The attestation, the amount of income that someone says they project to have on their application, the attestation is accepted if it's higher than the income in the data hub, regardless of the income differences. There are a couple of exceptions there. Or the attestation is lower, but it's not so low that it's triggering this threshold. Now, where a DMI will be triggered is if the applicant has an attestation that is 25% and $6,000 lower than the data available in the hub, or if there's no income information available in the data hub, that will also trigger a DMI. Now, if either of those occur, the applicant will be awarded subsidies based on their attested income, but they have to provide documents to verify their household income. Now, one new wrinkle this year is a new population is going to be asked to verify their income, and that's the group of people whose attestation is above the poverty line, but data sources suggest that their income is below the poverty line. And they're using the same thresholds as are used for other populations. So this is a new group that's going to be subject to these inquiries. A little bit more about that. The DMI is going to be triggered if all of the following are true. The applicant attests to projected income between 100 and 400% of the poverty line, and they're otherwise eligible for PTC, so nothing else has disqualified them. But data in the hub indicates income below 100%, and attested income is more than a reasonable threshold above that. Now, in practice, this is really meant to make sure that people who are on the cusp of the poverty line, so perhaps people who are in the coverage gap, are not being overly optimistic about their income in order to qualify for coverage. Maybe that's a slightly cynical view on why that this new rule is in place, but I think it's pretty much backed up by what they've said in the regulation. This will not apply to non-citizens who are lawfully present and ineligible for Medicaid due to immigration status, because as you know, that population is already eligible for premium tax credits below the poverty line. So they're not going to be asked, shouldn't be asked, to submit new information based on that. So let's look at an example. This is Walt. He's a graduate student, and he works part-time. In 2017, he worked part-time. His annual earnings were $11,400, and he was just under the poverty line. So he was ineligible for a premium tax credit and ineligible for Medicaid due to his state not expanding coverage. So he was in the coverage gap in 2017. He continues working. Late 2018, he gets a raise, and that puts his income above the Medicaid, or it puts an income at 139% of the poverty line. So in this case, his projected income exceeds his prior income by more than 25%, but less than $6,000. And so even though he appears to be in this group where he was in the coverage gap, but now he's not in the coverage gap, no DMI is going to be triggered because the threshold between his old income, which is what the data hub is going to have, versus his projected income for the coming year, that difference is not great enough to trigger a DMI. But let's change the example just a little. So let's say that in 2017, Walt had less income. So let's say, okay, he was working 20 hours a week, but let's say he was only working 40 weeks a year because he was working during the semester, and he was away during summers. He said he's a student. So his annual earnings were less, and that means that the data hub is going to have his income as a lower number, which will show up as a difference of greater than $6,000 and 25%. And so in this case, a DMI is triggered, and what will Walt do? So Walt will still enroll in coverage. He'll still get APTC and CSR. But he must submit documents to prove his attested income within 90 days. To prove his new income, there are a couple of things he can do. So he can get a letter from his employer that shows the increase in wages and the increase in number of weeks worked. He could use a pay stub or show a copy of a check paid to him as wages to show his pay raise and increased hours. And so he does that in January. Walt submits a pay stub with his higher hourly wage and increased hours with a letter explaining his new hours and expected annual projection. Walt is on it, and his DMI is resolved, and he continues without interruption. There are a number of reasons that, and I think that Shelby kind of hinted at some of these, but there are a number of reasons that data matching might not verify your income, and that's because life happens and things change. You could have a change in job, a change in hours of employment, a change in household. You could retire. You could have self-employment income that's going to have more fluctuation anyway. A person could have a one-time income, such as an IRA withdrawal, or could have, now like an annual pension or something that kicks in. Or, and this is the big one that is going to trip a lot of people up, especially I think people who are around the poverty line and maybe inconsistent tax filers because they may not always have a tax filing requirement. A DMI will also be triggered if there's no tax data available. So that's going to be important to keep in mind. So what if there aren't documents available? What if you're a little flummoxed about how you prove the income that you believe to be an accurate projection? Well, one option is to submit a signed statement that includes your household information and an explanation of the income projection. So here you can see we have Kayla, and she puts her application ID in there. She puts her contact information, the date, what was her annual projected income on her application. And then she explains why she projected what she projected. And when she submits that, the government contractor will decide if this is a projection that seems to be reasonable. Someone has a DMI, the applicant will receive instructions on the next steps, asking documents that you can send. And here's just some of the documents that you could send. One thing to keep in mind is that if you have a DMI, there may be something where okay, that's something I'm going to have to verify because that's the thing that changed. So let's say that you have wages, and those have changed. You lost a job, you got a new job, so there's been a big change in your wages, but your spouse has Social Security, and that has remained constant across the last several years, so that hasn't changed at all. So when you contact the marketplace and are trying to go through this DMI process and submit information, remember that you're not just submitting information to verify that thing that changed, the wages that have fluctuated. You should verify the entire amount of income. So that includes verifying the amount of Social Security. So when you send documents into the marketplace for verification, make sure that it presents the complete picture of the income that you have projected on your application. And here's one way to do it. The marketplace has a guide that has a lot of different tables and suggestions and a list of all the documents that you could submit for for different kinds of income. This is very helpful. You should definitely take a look at it. One thing that they include is a self-employment chart, so how you can explain what your self-employment income is expected to be, expenses you paid, average that out, and come up with an annual total. So these are some really helpful tools. We'll do a quick example. This is Jalen. He's self-employed, and Maya works part-time at a bookstore. And Jalen has self-employment income of $50,000 in 2017, which is the most recent tax year that the marketplace will have data on. But he loses his best customer. And so he expects his income will be lower, half that of what he had in the past. So when he's applying for coverage for 2019, they have a lower income projection. And the attestation is more than 25% and $6,000 lower below what their 2017 tax return shows. So in this case, DMI is triggered. The marketplace is going to provide APTC based on the attestation. So they're giving APTC based on that lower income, higher APTC, and gives the family 90 days to submit documentation. If they fail to do that, the marketplace is going to use their 2017 tax return income information as the basis for determining premium tax credits. So they could see their tax credit go down, or in some cases, depending on the income, they could lose their tax credit altogether. So in Jalen's case, what can they submit to show the math of what their projection is? Jalen has a ledger that shows his income and expenses. Now, that sounds complicated and like you should be an accountant to do that, but you don't have to be. This is really just, here's what I expect to get. Here's my expenses that I can take on my tax return, and then here's the difference. So it can be that simple. He could also submit a statement that he lost a client from 2017 and he doesn't expect to be able to replace lost income. And he can submit Maya's most recent pay stub. So remember, even though Maya's projected income is the same as before, let's not forget to include her income to make sure we're showing a complete picture. I think we're going to skip over this example for time. Let's go to this one. Diane plans to retire in February and will start receiving Social Security benefits. She also plans to withdraw $5,000 from her retirement account. Now, this can be a little tricky because Diane, she doesn't have a history of withdrawing money from her retirement account. And so it's just her intention. You know, how do you prove your intention? Well, you prove your intention by submitting a letter or other proof so she'll submit a letter about her Social Security award letter or a statement of benefits, and she can submit her own personal statement regarding her intent to withdraw funds from her retirement account. If the DMI is not resolved, so you just can't get to a place where the information is, you know, within the reasonable threshold of the data hub, then subsidies can be changed to the amount that is available in the data hub. So in this case, the 2017 amount. And if the information shows income under the poverty line or over 400%, then subsidies could be terminated. Subsidies could also be terminated if income information is not available to the marketplace and you failed to submit information to resolve the DMI. So that means that enrollees will have to pay a higher share of their premium. But remember that if you've set up an automatic payment, that the new higher premium amount can be withdrawn from the consumer's bank account. So you have to make sure that there are funds available to do that. And some people have run into problems with their bank when funds were not available and they had this unanticipated, much larger premium. And if the enrollee does not pay the full premium, but also does not cancel coverage, the grace period will begin. which is the subject of an entirely different webinar. People can restore subsidies after they've lost them by appealing. In an appeal, they can get a retroactive premium tax credit. If a person does an appeal or if the appeal is unsuccessful, you could still get a premium tax credit for those months when you didn't have APTC, as long as you stayed enrolled and paid the premium, then you can get it on your tax return. So all isn't lost if you do lose the credit if you have the means to continue paying the premium. So in the interest of time, let's just move on to other kinds of verification that you might have to do. There is an electronic match with Medicaid agencies, Medicare, and the Office of Personnel Management to show if the applicant is enrolled in or eligible for other minimum essential coverage. Because if they are enrolled in other minimum essential coverage, they are not eligible for APTC. And so in this case, if the data show that you are eligible or that you are enrolled, usually in both, let's say, Medicaid and marketplace coverage with APTC, you will get a letter and an initial notice, and you will need to prove that you're not eligible for or enrolled in other MEC. In general, you're going to need some kind of letter, notice, other proof of the source from the source of coverage that you're not enrolled in. So maybe, a Medicaid termination notice or something. It can be difficult sometimes for people to generate information that they're not in a program. And if you don't resolve this within a certain time period, then they will yank the APTC. But again, as in other cases where APTC is terminated, you are still enrolled in coverage. And so if you can continue paying the full premium, that's great. You can continue to stay in that coverage, but you won't be able to receive APTC.
And I'm going to go very quickly through identity proofing. Identity proofing is not a data matching issue. It's a whole different thing in and of itself. So that's important to remember, but boy, does it get very confusing. And the reason why I kind of mentioned that is that sometimes people will say, I don't get this. The person was already verified their citizenship or their immigration status. Why on earth are we also having to do identity proofing? Two different things. Identity proofing is really something that is needed by the application so that it can fulfill its requirement to protect information that the consumers, that the different databases that are sharing information and verifying information about the consumer, in order to access those kind of systems, the marketplace has to verify that the person is who he or she says she or he is, so that they're not disclosing any potential information. So, consumers can have access to a marketplace account, but it's going to, without being identity proof, but it's going to be extremely limited. So you aren't able to submit an application online. You're not able to select a plan online or report changes online without having an account that has been identity proof. So what generally happens when somebody can't be identity proof is that a consumer will pick up the phone and call the marketplace, and they'll have to do these kinds of things over the telephone with the marketplace operator. So the marketplace operator is kind of the go-between, in terms of the consumer having access to a fully accessible marketplace account. So I have gone through in a very, very fast way these pieces because I know that we're running out of time. So when a consumer, is not able to be identity proof, there is a way, because the way that it happens online is basically the application is going to ask the consumer for certain pieces of information. the marketplace is going to try to match that information with information that Experian, which is a credit reporting agency, has. And if Experian can generate questions for this consumer because they have sufficient credit history, they're going to ask them those questions. And then if the consumer is able to answer them correctly, they get through identity proofing. But like I said, not everybody has a sufficient credit history, or not everybody, sometimes there's mistakes in their credit history, so they might not know how to answer some of those questions. So for a variety of reasons, there are certain people who aren't able to make it through that step. When that happens, there is another step where you can pick up the phone and call Experian and try to get through that way. In other cases, consumers are asked to provide documents. And here, documents that prove their identity. You can, again, submit these documents and eventually get your identity proved. And if the consumer you're working with is able to accomplish that, that is really, really good, because it's helpful for a consumer to have full access to their marketplace account, as opposed to having to go through the marketplace each time they want to make any kind of change or select a plan, or all of those other things that require having an identity proofed marketplace account. You would have to have gone through it to be able to accomplish those things. So consumers can submit these kinds of documents, and then when they maybe either in the interim, or if they really truly don't have access to those kinds of documents, then they can do all of these things through the marketplace marketplace call center. I'm going to skip these tips. We've gone through a lot of them during the presentation, but we have them here as a resource. As a rule of thumb, just remember, try and answer all the questions that you can, safely and comfortably and securely and accurately answer, as you're helping people through the application process. And again, we just have a bunch of resources here that we've also talked about throughout the presentation, and our contact information as well. Hallie?
Okay, and I know we're running short on time, but we're going to answer like a couple questions. And if your question doesn't get answered, if you have any questions, please email us. You can email myself, Hallie Cloud, or that Beyond the Basics email, and we'll get an answer to you. And again, we have a record of your questions as well. We know this is a lot of information, but again, you'll have the slide deck, you'll have this video. But a couple questions. One question that was asked was for if you have an income data matching issue and you lose APTC, you lose tax credits, and then you resolve the DMI afterwards, that you can only get PTC going forward. It's prospectively that you would get the PTC going forward, and if there's any way to get it retroactively.
Well, so it depends, I think, on how it was resolved. So if it was resolved through appeal, then you could get retroactive PTC. But remember, in all cases, you need to pay the premium. And that is often the barrier for people. So I know I don't hear a lot about people. Shelby and I were kind of looking at each other because we don't hear that a lot about people losing their subsidy through because of a data matching issue, and being able to continue the premium long enough to get through appeals, and then to get that back subsidy. So most people, if they do resolve it, they'll get the subsidy moving forward, and then they'll claim on their tax return. They'll be able to get for those months that they missed.
Perfect. And then for the sort of new rule for people who have to verify their income if they attest to income above the poverty line, but their data sources show income below the poverty line. So let's say that happens, they get a DMI, they resolve the DMI, they continue with APTC, but then at the end of the year, when they file their taxes, their income is actually ends up being below the poverty line. Do they have, does that safe harbor for people who are sort of in that situation where they would not have to repay all of the advanced premium tax credit that they got? Does that still apply in that case?
Yes, that's a great question. Yes, the safe harbor from the IRS for people who received APTC because they attested um, to be income eligible, but then it turns out that they weren't. Those people right now, they don't need to repay, and that continues to be the case. They don't need to repay because their attestation was wrong. The fact that you got through the marketplace process, even if you had to go through a DMI to get there, the fact that you got through a marketplace process to get APTC is the evidence that the IRS needs for that safe harbor to apply. Now, if you or someone, let's say that you, miracle of miracles, you managed to pay your premium, even though you're below the poverty line, you still pay your premium, full premium, and then try to claim APTC or then try to claim a premium tax credit on your tax return, that safe harbor is not going to apply because you did not receive APTC. So APTC is a necessary component of getting that safe harbor at the end of the year from the IRS.
Perfect. And then we had a question about ITINs identification, individual taxpayer identification numbers. Sorry about that. So an ITIN for someone who uses that to file taxes, is that ever something that someone would need to put into the marketplace application?
Certainly healthcare.gov does not ask for ITINs, and nobody would want to put that information into healthcare.gov. So that's the answer for 39 states. There really should not be a request for ITINs in any state-based marketplaces as well. It's never going to be used for data matching purposes with the IRS to be able to get income information. It's also not relevant for any kind of immigration kind of verification. So there's no purpose for doing that. Having said that, I do believe that there is at least one state-based marketplace that requests ITINs, and I think it's unnecessary for that to happen. And if it's a question that can be skipped, I see no reason, and I don't know, the answer to that. If you can skip the question in that one state-based marketplace that has the question, but if you can, then it would be good if you did.
Perfect. We'll do one more question. So what do you do if someone does not have a social security number, but does have other documents and is eligible for coverage?
That happens, quite a bit. There are plenty of lawfully present people that meet the immigration requirement to be able to enroll in marketplace coverage, but they're not eligible to have a social security number. The application will ask for a social security number many times, but you should never provide a number that you don't have. You should never provide any information in the application that is not correct. So if you don't have a social security number, you don't provide it, and there's an avenue, different avenue, like we talked about, there's options to provide paper documentation in the cases that you otherwise would there would be a requirement to have a social security number to do the kinds of data matching behind the scenes. So absolutely, if somebody doesn't have a social security number, they should not provide one or attempt to provide one.
Perfect. And we're going to wrap up the webinar now. Again, if you, I know you had, we have a lot of questions and a lot of really good questions. So please feel free to email those to myself or that Beyond the Basics email, and we'll get an answer back to you as soon as we can. A few words in closing. We're going to be distributing, again, the slides from today's session and a video recording of the webinar in the next few days. We'll also post it to our Beyond the Basics website at healthreformbeyondthebasics.org. You can also access past webinars, past trainings. We have webinars on the premium tax credit, how to determine income and household size, plan design and selection. We have all sorts of webinars up there, and we'll have more as we get closer to open enrollment. Our next webinar is next Thursday, October 18th. at 2 p.m. Eastern, 11 a.m. Pacific, and it is on best practices when assisting people with disabilities enroll in health coverage. And that will be a special guest presentation by the American Association on Health and Disability. We also are going to have a presentation on Tuesday, October 23rd on immigrant eligibility and the enrollment process for coverage programs. A lot of that overlaps with what we talked about today. So for some of the more detailed questions on kind of immigrant eligibility for coverage programs, please tune into that webinar. The registration information for that webinar is on our website right now under upcoming webinars. And we'll also email it to you all with the other resources from today's webinar. And we're going to be presenting that webinar in partnership with the National Immigration Law Center. So we're really excited about that. Again, all of our materials are posted to that Beyond the Basics site. So please go to it. If you see anything that you would really love to have that we don't have on the website, some sort of tool, that would be really great. Please email us and we will try to put something together. You guys are on the ground, so you know what you need. So definitely let us know what is the most helpful. Again, if you have any questions, need any assistance going forward, please email us. And with that, I'm going to bring the webinar to a close. So thank you so much for joining us today, and we hope to see you in the next couple of weeks. So thank you so much.